Hi everyone, I'm Tamanna Islam and I'm a PhD student at the University of Utah in the Department of Biomedical Engineering, and I'm the recipient of 2024 PhRMA Foundation Predoctoral Fellowship in Drug Discovery. When I was in high school, it was my family, especially my brother, mom, and dad, and also my sister. They kind of like inspired me to pursue science in future. Later, I realized that science is the key to all questions that the universe has, and through scientific knowledge, it is possible to unlock all the hidden mystery that no one can explain through just observation. So my PhRMA Foundation funded project involves studying the underlying mechanism associated with arterial muscularization in hypertension disease. So usually what we see in hypertension disease is that there is two pathological changes. The first one is arterial stiffening. In that case, we see over accumulation of extracellular matrix component in the arterial region, and we also see accumulation of smooth muscle cells in the small arterial section. So normally the small artery doesn't have any smooth muscle cell. It has only a single layer of endothelial cells and it's very thin. But when the disease starts progressing, we see that over accumulation of smooth muscle cells, and it creates more layers into that small artery region. And as a result, we see reduced arterial compliance, and that would increase the blood pressure. And as a result, it would also affect the blood pressure in the heart. And as a result, we see heart failure as the last consequence. We are proposing a new mechanism, the mechanism of why we're saying this arterial muscularization. What we are proposing is that this smooth muscle cell is actually comes from the large arterial section, and it actually follows the arterial stiffening because of this accumulation of extracellular matrix. It would follow it and it will start moving from large arterial section to the small arterial section. And that's how it muscularizes the small arterial region. And we are also developing new drugs that would also kind of like inhibit this process of cell movement or cell migration, and that would kind of like reverse this process. So these drugs would be wide potential to treat early stage development of pulmonary arterial hypertension. The best advice that I got when I was an undergrad student, and one of my teacher, he told me that if you wanted to be a successful scientist or researcher, you need to have three qualities. The first one is being persistent. Whatever the challenges you face, you have to be persistent. You have to continue your work without not giving up and not being frustrated. You just have to move on and do it. And the second advice I got is that being patient, because you might fail 1,000 times, and a single research might take years for you to finish and to come up with the expected results, but you should not be stopping there and not give up there. You have to be patient for the better outcome. And the third advice was being hardworking. So no matter how good are you, have to be consistent with your work, and you have to be disciplined. You have to know how to manage your time. So hardworking is the third best quality that one should have for a career in research. And I want to add one more thing, is that you have to be kind to yourself. Whatever the criticism you might get while doing research, you have to be kind to yourself. You don't have to be worried about it. Just move on and then just do the work that you need to do. I want to explore things that have never been explored before, or that never been studied before. So for that, I want to have a career in academics, and also I want to have my own lab in future, so that I can collaborate with people and have students who have great minds, and I would like to share my thoughts with them too. So that's the plan for future.